Hi, welcome to another edition of our Healthcast here from 3, 2, and 1. Welcome to this week's Healthcast. Today we're going to talk about the importance of knowing your numbers. Your health is all about your risk. What are your risk factors? Are you really paying attention to those risk factors? Because keep in mind, your health is your responsibility. It's not your doctor or your spouse or your employer, certainly not the responsibility of the government. Your health is your responsibility, and you have a tremendous impact on your future as it relates to your health. A great place to start is to know your numbers around something called the metabolic syndrome. This is a great way to actually predict your risk of diabetes. The metabolic syndrome, 5 separate outcomes that when they become out of whack, when you have 3, 4, or 5 of these that are out of range, dramatically increases your risk for things like diabetes, heart disease, stroke, maybe even Alzheimer's. So the metabolic syndrome, these 5 risk factors, starts with your waist circumference. If you're a man greater than 40 inches, a woman greater than 35 inches at the biggest part around your stomach, that's a problem, because that type of fat, not the subcutaneous fat, but what's called the visceral fat, the packing tissue kind of fat around your internal organs, that's a tremendous risk factor for your future. Number 2 on the list would be blood pressure. If your blood pressure is greater than 130/85, that's not high blood pressure, that's pre-hypertension. Again, that's a red flag. Number 3 on the list would be glucose. Very, very important that your glucose is less than 100. If it's between 100 and 125, again, that's a warning signal. A greater than 126, that would be diabetes. But again, if it's above 100, that would be in the pre-diabetes range. Number 4 on the list, triglycerides. If they're greater than 150, that's a blood fat. You get it measured in a routine physical when they do your blood work. And number 5 on the list is your HDL cholesterol, your healthy stuff. If it's less than 50 in a woman or less than 40 in a man, that is a red flag. Women naturally have higher levels of HDL cholesterol. So know those numbers. Talk to your doctor about the significance of what they mean and find out if you have the metabolic syndrome. You can always get more information at 3-ddaily.com. You can also tune in every week to a fresh version of our Healthcast. In the interim, though, I sincerely encourage you to have a healthy day. Take care.